And mute yourself and repeat after me, and we'll get tons of time to practice, so don't worry. So for complete denture, it's going to be la dentadura total, or you could also say las placas. And then RPD, which is removable partial denture, is la dentadura parcial, or you could also say los parciales. Okay, now extraction, la extracción. Root canal, la endodoncia. And then scaling and root planning is going to be la limpieza profunda. And then these are kind of like bonus. I know you're not going to use these on a daily basis, but braces, los frenos, and retainer, el retenedor. And then some bonus words, bracket, you would say el bracket, kind of the same thing. Ligature, la liga, and then wire, el alambre. Okay, so now abscess, el absceso, ulcer, la úlcera, inflammation, la inflamación, pain, el dolor, bacteria, las bacterias, caries, las caries, decalcification, la this is long, descalcificación, decayed, cariado, and then impacted wisdom teeth, you could say la muela del juicio impactada. I know there's different ways of saying wisdom tooth. You could say like los terceros molares for like third molars. Periodontitis, la periodontitis. Periodontal pockets, las bolsas periodontales. And then gum recession, la lesión gingival.
Entonces ahora vamos a practicar. Esto es una más avanzada. Si a alguien le gustaría tratar de explicarle al paciente que tenemos ahorita qué es lo que necesita. Podemos agarrar voluntarios. Ok, vamos a intentar unas oraciones entonces. Aquí tenemos algunas de las cosas. Entonces vamos a traducir esto. If we cannot stop the inflammation in your gums, you will have gum recession. So does anybody want to help me translating some of the things in Spanish so you can explain to your patient? Okay, I'm going to start asking on people. Let's see. Sina, can you help me with the first sentence, please? Come on, guys, I can help you as you go. The more practice you go right now, and this is the last session. Come on, come on.
Fernanda, can I try?
Yes.
Okay. Si no podemos parar la inflamación en I forgot gums.
Encías.
Encías, usted va a tener una gum recession.
Okay, so how do you say gum?
Encías.
Encía, that will be one. And just read this in Spanish.
Encía recesión.
Yeah, and you would just switch it.
Recesión encía.
There you are. Great job. You can say recesión de encía or recesión gingival. Both of them can work. Patients will understand better the one that you use. Yes, the sign-in sheet, it will be, oh, thank you so much, Giselle. And so now we can go back. Thanks so much, Trey, for volunteering. So now let's go ahead and try the second one. Who would like to try the second one? Let's see, Cameron. Can you help me with the second one? Okay, I guess Cameron is not here. Wait, I see something in the chat. Cool, thanks. Yes. Okay, Jimmy, come on. Can you help me with the second one? Okay, I can do it myself. So if you're at home, just repeat after me. Let's see. No worries, Cameron. Let's see. So because you have deep periodontal pockets, I need to measure each of them. So, porque tiene, and so in this case, it's going to be bolsas periodontales profundas. So bolsas is bags or pockets. Periodontales means periodontal. Profundas means deep. Necesito medir cada una de ellas, which means like I need to measure each one of them. Now let's see for the next one. Let's see who would like to help me. Anybody that doesn't have any lab background or anything like that, remember the more practice, the better will be when you with your patients. Let's see, who should I pick on? Jessamine, can you help me with the third one?
Sus encías, ellas, or estar.
Están, yeah.
Están. I forgot swollen in Spanish.
It's okay. Swollen would be inflamadas or, yeah, inflamadas. Hinchadas also.
Hinchadas. Y sangran mientras que yo remuevo el sarro. Este es un signo de periodontitis.
Perfect. Great job. Let's see. We have something in the chat. And it's okay. Now let's see. For the fourth one, it's a little bit on the long side, so I'm gonna be one doing that. So at home, please practice it. So tú debes, you should hacer una, do a. Then the next thing is cirugía, which is surgery, periodontal, para mejorar, to improve, la salud, the health de sus encías, of your gums. En la cirugía, at the surgery, retraemos, so we remove las encías, the gums, para limpiar, to clean, completely, cualquier sarro en los dientes. So any kind of sarro means calculus of the teeth. Y luego ponemos las encías de regreso en su lugar, which means later we're gonna put them back in their place. I know that was like a very long sentence, but this will be pretty much explaining what a surgery is to a patient. So it could be something that you could just like, how would you, when you have the patient, so that way like you can communicate what exactly they're gonna do at the periodontist. So now here we have some past tense that we can practice a little bit easier on the easy side. So I'm gonna break on Brianna. Nguyen, can you help me with the first one?
Sus dientes se ven más sanos y más limpios. Tener una limpieza y su inflamación se mejoró.
Yeah, so in this case, it wouldn't be tube, it would be tuvo. That was like a little bit of like to help you. But that's like the past tense for I, but yeah, no, for you, sorry. You had, but you did great, Brianna. Thank you so much. Now let's see, Chiaki. Can you help me with the second one?
Haber.
How, okay, this will be my hint.
Hubo mucho placa en el pasado. Debe contrarse en cepilarse sus dientes en estos lugares.
Perfecto. Only thing I will have to say is regards this one, which I know it's a long words. That's okay. Concentrarse.
Concentrarse.
Perfect. Great job. I didn't even hear any accent. Great job, Jackie.
Gracias.
Now let's see who can help me. Mitali, can you help me with the third one? Let's see. Maybe Mitali is on the busy side.
I can help. I can do it. Oh.
I don't know who that is, but both of you, one does the first one and the other one does the second one. Come on.
Okay. It's hicimos cirugía, that one?
Mhm.
Okay. Hicimos cirugía periodontal porque tenía bolsas periodontales. Tenía recesión gingival porque tenía periodontitis.
Perfect, Shauna. That was a perfect Spanish. Great job. Now let's, the second person, I don't know who that was, but
I can try the next one.
yours.
Sus radiografías muestran que perdido hueso. Removimos todo el sarro y su hueso regresó.
Perfect. Only thing I will say is this one, remember, the accent right there tells you that the strong sound is at the O. So it will be perdió.
Okay. Thank you.
Thank you, Mitali. Now for the next one, now we're gonna practice hearing. So you can practice like understanding somebody to speak Spanish. And for this one, Giselle's gonna help me.
Okay, so for this one, this is gonna be as if I'm the patient and I'm giving you my chief complaint. Also, if you're not muted, can you please mute? Okay, so, se me cayó el relleno de mi diente. So can anyone guess or tell me what they think I said in Spanish?
The filling came out of my tooth or fell out of my tooth.
Yeah, perfect. Okay, so now I'm gonna try the next one. El diente con el relleno estuvo sensible ayer. Someone else, tell me, what did I just say in English?
The filling is sensitive.
Yeah, perfect. So the tooth with the filling was sensitive yesterday. Mhm. Okay. ¿El relleno va a ser blanco, de amalgama o de oro?
Can I do this one?
Yeah, of course.
The filling is going to be white, amalgam, or gold.
Perfect. Yeah. Okay. So, no me gustó mi relleno viejo de amalgama. What did I say?
Is it you don't like the look of amalgam fillings?
Yeah. So I don't like the look of the my old amalgam filling. Yeah. Viejo means old. Perfect. You guys are doing great. Okay, last one. El color de este relleno está horrible. Remuévamelo. Any takers for this one?
The color of this filling is horrible. Please take it out. Not please, but take it out.
Yeah, perfect. Exactly. Yeah, you guys did great. I didn't need to correct anything. Okay, so now I'm gonna, can anyone tell me, or I guess, yeah, we could just have some volunteers read a couple of these. So for the first two, someone read the question in Spanish. Any volunteers?
I can read it.
Okay, go ahead.
Do I just read what it says?
Yeah, yeah.
Okay. ¿Por cuánto tiempo le dolió?
Okay, and how about the next one?
¿Dónde le duele?
Perfect.
And then, okay.
Oh yeah, do the next one. Go ahead.
Okay. Blank le molesta los dientes?
Yeah, okay, perfect. Let me get somebody else for the next three. Okay, I'm going to.
¿Tiene sensibilidad a cosas frías o calientes?
Okay, how about the next two?
¿Tiene sensibilidad a cosas dulces? And then la molesta cuando duerme?
Yeah. The only thing I would correct is I think you said la, but it's a le. Le molesta cuando duerme. Otherwise, perfect. Okay, and then let's have one last volunteer for the last 4.
I can join.
Oh yeah, go
S
ahead.
SL dollar pulsante, SL dollar espontáneo, alguna cosa lo hace sentir mejor o peor. And ha ido al dentista anteriormente.
Yeah, perfect. Good job. That was a good try. So a couple of things. Dolor, that's how you would say pain. Dolor.
Dolor.
Dolor. Mhm.
Dolor.
Yeah. And then what was the other thing? I think mejor.
Mejor. Is that right?
Mejor. Yeah. And then for when you see an H in Spanish, you usually don't pronounce it, but it's at the beginning. Actually, I don't know if you pronounce it ever, but it's silent. So you would just say ido. You wouldn't say ha. You would just say
Ha ido al dentista anteriormente.
Perfect. Yeah, good job.
Thank you.
Okay, so we're gonna do another chief complaint slide. So have some more volunteers tell me what I'm saying in English. Okay, me duele aquí en este diente. Somebody tell me.
I'm having pain on this tooth.
Yeah. Okay. Cuando comí ayer, mi diente me dolió. Let's see.
When I ate, oh, sorry.
Go ahead, no, go ahead, Laura.
Okay, thank you. When I ate yesterday, my tooth hurt.
Perfect. Okay. ¿Estás sensible con cosas calientes y frías? How about Laura? You wanted to go, right? Or was it Shauna?
Yeah, I'll go ahead. It's sensitive with hot and cold stuff.
Yeah, perfect. Okay. Tengo un absceso en este diente.
It's like I have an abscess in my tooth.
Yeah, perfect. Okay, last 2. Mis encías me duelen en este lado.
My gums hurt me on this side.
And last one. No me duele oh, sorry, I read that wrong. Okay, no, me duele aquí también en la encía. Let's ask them.
So is that no? It also hurts me here in the gum.
Yeah, perfect. You guys are doing great. You guys are going to be experts at talking to your patients by the time you get to 3rd year.
And so now we have some things going on in here. So what do you think is going to be your category today? Well, for this part. Any volunteers? I know for sure the D1s, they haven't covered this, but D3s and D4s, they know this too well. Let's see. Alisa, I know you're here. Sorry for picking you up. What do you think we're going to cover right now?
Are you asking me?
Oh, Alisa Nolan. Maybe she's busy. It's okay. We're going to cover endodoncia. And so let's go ahead and practice some of the common sentences that you will be saying to your patients. So let's see, since Alisa, the other Alisa, D1 Alisa, unmute yourself, I think. Can you help me with the first one?
Sure. Do you want me to just read the sentence?
Yes, please.
Okay. Tienes un absceso y un nervio muerto. Necesitamos hacer endodoncia.
Perfect. Yeah. And I know like in English, usually for root canal, you say like root canal, but you would never say that in Spanish. If you say the name of the entire thing, which is like endodoncy, like just translate to Spanish. That's the way they would understand you what that means. Now let's see, who would like to help me with the second part? Let's see, Kimsa. I think it's Kimsa though, if I remember correctly.
I can go. From,
Okay, so
Go ahead.
two people
Trey,
did.
go ahead.
Yes, go.
ok. Tu cara está hinchada, tienes un absceso epical y necesitas endodoncia y antibióticos.
Perfecto. Great job. And the second person, can you help me with the third one?
Yes. Tienes dolor agudo, espontáneo y despiertas de noche por el dolor y tienes sensibilidad y calor y al frío, ¿correcto?
Yeah, perfect. You can say correcto over that. It counts. Great job, you two. Now let's see who else. Who wants to help me with the last one?
I can go if no one wants to go.
Go for it.
Yeah, okay. Tienes un mal sabor ocasional en la boca y a veces dolor. La radiografía muestra que perdiste el hueso. Creo que hay un absceso.
Perfect. All endo experts. But now let's go ahead and hear the patient.
Okay, so yeah, I'm just gonna, how do I do this? Okay, so now you're gonna listen to the same thing, chief complaint, and tell me what I'm saying in English. Okay, ¿se puede salvar o rellenar mi diente? I'll do two at a time. And then the second one, ¿cuántos dientes vas a sacar? So somebody tell me about those first two.
I can do it.
Yeah, okay, perfect.
I think it's, are you able to save or fill my tooth?
Mhm.
Or restore, I guess. And then how many teeth are you going to take out?
Yeah, perfect. Okay, and then the next, actually these are pretty short, so I'll do the next three. So, me va a doler, first one, second one. Me va a dar una inyección. And then third one, tiene que sacar el diente. So someone go for those three.
I think I got them. Is it going to hurt? Are you going to inject me? And do you have to take a tooth out?
Yes, perfect. So the second one, instead of are you going to inject me, it's are you going to give me an injection? But honestly, perfect. Okay, and then we'll have a star volunteer for the last four. Okay, ¿qué va a hacer? And then the next one, ¿voy a poder manejar a mi casa? Third one, ¿cuándo puedo removerme la gasa? And then last one, ¿tengo que regresar? Who wants to take those four? Or even if you know two of the four, three of the four, just give it your best shot.
I think it's, what are you going to do? Can I drive my car back to my house? When can I take off? I think it's the gauze. Okay, and do I need a return?
Yeah, good job. That was amazing. Okay.
Now we got some gnarly, maybe not so restorable cases. And so we're going to go over some of the sentences of how to explain to a patient that we cannot do anything. We just need to like do certain things. So for example, for the first one, who would like to help me to explain to a patient that the root broke? And what are we gonna do about it? Let's see. Min, can you help me with the first one?
Yeah. Let me try. El diente tiene una fractura hasta la raíz. Lo vamos a extraer.
Perfecto. Perfect. Great job. The next one I would ask, let's see, Trey, can you help me with the second one?
Sure thing. Tus dientes estaban flojos, sueltos por la periodontitis. Por la periodontitis. Tuvimos que sacarlos.
Perfecto. Shana, help me with the third sentence.
Okay. No hay suficiente espacio en tu boca. Vamos a extraer tus premolares.
Almost perfect. No, it wouldn't be premolares, it would be premolares.
Okay, premolares.
Perfecto. And the last one, I know it's a hard one, so I will do that myself. So, vas a tener quimioterapia y radiación, which is like you're going to have chemotherapy and radiation por tu cáncer oral. Si no extraemos tus dientes muy cariados antes, tú puedes tener muerte de tu hueso. Si tratamos de remover tus dientes después, which is like all of this is saying is like the patient is having chemotherapy and radiation because of the cancer, oral cancer. If we don't extract the teeth that are very carious before, you're gonna have death of the bone, which is like osteonecrosis, which I know the ones you haven't learned this yet, you're gonna learn this soon. If we try to remove them later. So that will be like a long explanation just as a bonus for those overachievers. But now let's hear our patient some of their chief complaints.
Okay, so I'll do 2 at a time again. Okay. Estuve sin dientes por años. Quiero placas. Okay, second one. Me gustaban mis placas viejas. Se sentían bien. Okay, can I have a volunteer for those two? How about Samir?
Hi. So I'm translating them.
Yeah, so tell me, what do you think they're saying in English? Yeah.
I've been without teeth for years. I want dentures for the first one. Okay. And then I liked my old dentures. They felt good.
Yeah, perfect.
Thanks.
Okay, so now I'll have another volunteer for the next two. First one, están muy flojas. And then the next one, mis placas se han quebrado. ¿Puede reparármelas? Connor.
I'm sorry, I don't know what about 5 or 6 of the words in these mean. What is flojas?
Loose.
Okay, so they're very loose. I also do not know what quebrado or is oh, is that broken? Is that what you're saying, Fernanda? Okay, so my dentures are broken. Can you repair them?
Yeah, perfect. Exactly. So it's my dentures have broken. Can you repair them? Very good. Okay, next two. Las placas me molestan cuando como. And the next one, las placas me lastiman las encías. Who can I have? Brianna.
I can guess.
Yeah, go for it. Min, go ahead.
Yeah, so I think las placas me molestan cuando como. It's like the denture hurts me when I eat. And the second one is the denture is bothering me, bothering my gum.
Yeah. Perfect.
Yeah.
Lastiman, so molestan would be more of the bothering, and then lastiman would be more like they're hurting me. But otherwise, very, very good. And then the last one, yeah, can you just do the last one actually? So it's going to be, me muerdo los cachetes cuando como. What do you think that means? Okay.
I don't know what cachetes means.
Cheeks.
What is cheeks? Oh, okay. So when I eat, I bite My cheek? My cheek?
Yeah. Yes,
Okay.
yes, yes. Perfect. Okay, so let's see what this is. Okay, so I'll just have someone read these sentences in Spanish. So I'll ask for 2 volunteers. So first one, can someone read how long were you without teeth, or how long were you using dentures? And then also read what type of problems did you have with your denture?
I can do that.
Okay.
¿Cuánto tiempo estuvo sin dientes? Uso placas. ¿Qué tipo de problemas tuvo con su dentadura?
Perfect. Okay, and then the last 3. What did you like most about your old denture? Did you consider the possibility of dental implants, and you don't have sufficient bone for retaining the denture? Let's see, Sadaf.
So which one do you want to read?
The last 3.
Okay. Last 3. Okay. ¿Qué le gustó más de sus placas viejas? Considero la posibilidad de implantes dentales. No tiene hueso suficiente para retener las dentaduras.
Yeah, perfect. Okay, so just 2 things. Consideró, for consider.
Consideró.
And then for sufficient, it's suficiente.
Suficiente.
Perfect. Good job.
Now,
Okay.
last but not least, we're going to try some of the other treatments, which includes like a little bit of ortho, a little bit of like aesthetics. So for those people that want to do aesthetics, it will be the sentence that you want to do. So who wants to help me with the first 2 sentences? If you think your teeth are too yellow, we can do whitening treatment. And you're missing a front tooth, we can place an implant to fill the space. Let's see. If nobody volunteers, I will get somebody. Let's see. Since you're Monique Gao.
Okay. For the first one, si cree que sus dientes son demasiados amarillos, podemos hacer un tratamiento de blanqueamiento.
Perfect.
Do you want me to do the second one too?
Yes, please.
Te falta un diente is it anterior? I don't know how to say that.
It's okay. Usually, what is the sound of the E in Spanish?
So is it A? Like
Ajá.
anterior?
Perfect.
Podemos poner un implante para llenar el espacio.
Perfect, Monique. It was perfect. Great
Thank you.
job.
Thank you.
Now let's see. Brianna, can you help me with the last 2?
Entiendo que quiere una dentadura parcial para llenar los espacios en su boca. Primero, necesitamos tomar una impresión de su quijada superior e inferior. Podemos poner cells carillas en tus incisivos y canillos para cambiar tu sonrisa.
Perfect, almost perfect. Only one little thing. So this one is quiere.
Quiere.
Perfecto. Then the next one, esta es quijada.
Quijada.
And superior.
Superior.
Perfect. And last one, it will be this one, incisivos.
Incisivos.
And you got it, this one at the end, but just remind you guys with double L sounds like a G sound. So in this case, it's carillas.
Carillas.
Perfect, great job. Now we have some common patient commands that you will be using while treating a patient. And I will let Giselle take this one away.
Yeah, so these are very important. I find a lot of people knowing this terminology, even though they're not Spanish speakers. So it's something that'll just stick and it's very useful to know. So open your mouth, close your mouth, and then bite together. Can I have a volunteer for those three?
I can do it.
Okay.
Abre la boca, cierre, cierre, okay, I can't roll my R's. Cierre la boca, muerde.
Perfect. And even if you can't roll your R's, it's fine. Your patients will know exactly what you're saying. Okay. Bite down gently, lie down. Let me have a volunteer for those. Let's see. Brent. Okay, maybe he's busy.
I can go, but I don't really know how to pronounce it.
Yeah, go ahead.
Okay. Muerde gentilmente or gentilmente, and then acuéstase.
Yeah, almost perfect. So the G in Spanish has like an H sound. So it's like gentilmente. And then the last one is acuéstese.
Okay, thank you.
Good job though. Okay, and then a volunteer for the next three: grind, chew, and rinse.
I can do it real quick.
Okay.
Rechine los dientes y mastique.
Okay, and then rinse.
Oh, I didn't. Oh, my bad. Okay. And it's enjuaga.
Yes, perfect. And then let's see. So for the grind, you would tell that to your patients when you're telling them to bite on the, what do you call it? The articulating paper. Okay, and then the last three: spit, move the tongue, and sit up.
I got it. Escupe, mueve la lengua, and levantasa.
The first try was better. So it's levántese.
Levantese or levantese. Okay, thanks.
Perfect. Thank you. Okay, so now we're going to practice these next four sentences. So turn your head towards me. Mueve la cabeza, blank. Can I have a volunteer for that? And even if you don't know it, just give it a try.
Can you just say Ami?
Yeah, so you could say hacia mí. Yeah.
Okay.
But perfect. Okay. And then someone for the next one. Turn your head to the other side. Mueve la cabeza, blank.
Mueva la cabeza para el otro lado.
Yeah, perfect. Okay. And then since the last two are the same, let me have one volunteer for both of those. Turn your head towards your right and then towards your left. Okay, Monica.
Mueva la cabeza hacia tu izquierda.
And then the last one.
Oh, my bad. Mueva la cabeza hacia tu derecha.
Yeah, very good.
I have a question.
Yeah.
What's the difference between saying the like hacia tu izquierda versus like a tu izquierda?
I guess there's not really a difference. You could say either or, right, Fernanda?
Yeah, so hacia means towards, and
it does.
will be to.
Okay.
Yeah, so it's just like a different word, but both of them would make sense.
Okay, thank you.
Okay, so some of these we've already practiced. So yeah, we already did the first two, but let me have someone do the first three. How would you conjugate those words so that they sound correct? Chiaki. You there?
Yo abro, I don't know,
Would it be abre tu boca?
abre tu boca.
Mm-hmm. Okay, I'll pick on somebody else for the next two. Someone try the next two.
I have a question. Do you say abre tu boca or abre su boca, or which one's better?
When you're talking to your patients, we're trying to teach everyone to use the formal way of speaking to your patients. You could say tú, but that's more if you're like, it's more informal if you're talking to someone younger. But since most of our patients are older and we haven't built that relationship with them yet, it's better to use the formal way. So you would say su instead of tú.
Okay, thank you.
Mm-hmm.
I'll do the next one.
Okay, perfect.
Cierre tu boca, muerde gentilmente.
Yeah. Mm-hmm. Perfect. And then the last three, grind side to side, rinse and spit, and then move the tongue. Reese, do you want to try those three?
I forgot what side is, but Rashina, I forgot
De
side.
lado a lado.
Oh, al lado? Okay. And then enjuaga y escupe. And then mueve la lengua.
Yeah,
or,
perfect.
Oh, mueva.
Mueva,
Wait, why
yeah.
is it mueva?
We had, so this is informal. So these are informal. So if you use mueve, it's actually better. Yeah, we did this, and I guess we didn't look at this. Don't worry about it, guys. But yeah, try to keep it formal.
Okay.
And then I think you said enjuaga. That would be the informal. Enjuague is the formal.
Enjuague. Okay. Thank you.
Yeah. Okay, good job. And then also, if you ever forget how to say something, you can always use this safety net and basically do it yourself and then say hágalo así. So that's like a phrase to for sure remember so you can get your patients to do anything that you are doing yourself.
So now we're gonna cover some of the radiography for the dental, which is mostly like we're gonna cover some of the things that you can say to the patient as you're trying to take the x-ray so they know what they need to do. And so let's see, who wants to help me with the first two? We are going to take x-rays and open, close your mouth, please. Let's see, who should I choose today? Saraf, help me with the first two.
Abra la boca, cerro la boca, por favor.
Perfect.
No muevo.
No mueva. Yeah,
No mueva.
You almost got it. No mueva means like I, myself, don't move. So, but how will you say the first sentence?
Abra la boca.
We are going to take x-rays.
Hacer.
It's okay. You can, here's a hint.
Okay. Vamos a tomar radiografías.
Perfect. Thank you so much. Great accent, great pronunciation. Now let's see. Reese, can you help me with the next three, which is lower or raise your chin and please remove your jewelry and put your tongue on the hard palate.
So baja or levanta. El mentón. Is that how you say that?
Yeah.
Okay.
And mentón is more like that will be said in Spain. So it's more common to say la barbilla.
Okay, la barbilla.
And if you want a way to remember, barber comes from the idea that they're like removing the beard. So that's the reason barbilla. Yeah.
Interesting. Cool. Okay. Let's see. I'm trying to think of what remove is. Por favor. Could you say oh. What verb is that? Quitese? What verb
It's
is
like
that?
it's almost like quit, quitar.
Oh, could you use sacar?
Sacar, that's like take out.
Oh, take out, not take off. Okay,
You
so
can use remueva.
remueva. Oh, I haven't heard that one.
Yeah,
Okay, por favor, quítese sus joyas.
Perfecto. And last but not least?
Oh wait, is palidar the verb? Oh wait, no. So it'd be, is it pon la lengua en su paladar?
Perfecto.
I don't know what hard is.
No, you don't have to say that. If you just say paladar,
Oh.
they would understand.
Okay. Oh,
Yeah,
ponga. Okay.
Yeah, but you got pon works as well.
Yeah, I was like, it's something like that.
Believe me, patients are gonna understand.
Okay,
So for
thank
these
you.
ones, great job, Chris. For these ones, like the bonus questions are for you guys, so you can repeat it like after me. So, are you pregnant? ¿Estás embarazada? There's like a very funny story. Make sure that you're not saying like I'm embarrassed. That doesn't work. That if you say like estoy embarazado means like I'm pregnant. That happened to a friend in Mexico, and he said that thinking that it was embarrassed. Don't do that. Now, it will bother you a little. Le va a molestar un poco. This can help with not only radiograph, but it can help with anything. And then este chaleco de plomo es para su protección, which is like this lead apron is for your protection. So last but not least, we gotta have some instructions for impressions. And so I know that the D2s already learned how to do this. Soon to be, the D1s are gonna learn. And so who wants to help me with the first two, which is we're gonna take an impression of your teeth, of your mouth, and breathe through your nose. Let's see. Who should I ask right now? Shauna, can you help me with the first two?
Yes. I'm not sure if I'll know how to do it, but vamos a tomar una impresión de sus dientes o de su boca y respira por tu nariz. Respire por la nariz.
Perfect. So if you were to say respira, that would be the informal way, but that actually works as well. Great job. Now let's see, Samir, can you help me with these materials like rubber and relax?
Este material es como gomo.
That's a misspelling. That would be goma. I don't know. That's
Es como goma. And then relájese.
Perfect.
Okay.
Yeah, you got it. Let's see. And I think we have a question. Yes, let me send it to you right now. Thank you, Giselle. And then, last but not least, let's do the last two. Who will be the person that closes this class? Let's see. Come on, guys. I don't want to ask anybody. I want this to be like a volunteer thing. Yeah,
I can try.
Okay, go for it, Trey.
So it's the raise your right leg one, right? That's the one we're on.
And yes, and you have a strong gag reflex.
Okay, you might have to help me out a little bit, but levanta su pierna derecha.
Perfect.
And tienes un reflejo nauseoso muy fuerte.
You got it, muy fuerte. Great job. And so the bonus one is we are going to take some pictures of your teeth. So vamos a tomar unas fotos de sus dientes. And that's it. So thank you so much for everybody that came today. If you haven't already, please make sure to fill out the form which Giselle, she already sent. If there is any questions, you can go ahead and ask them right now. Otherwise, we are done for today.
Thank you guys.